Welcome back, viewers. Thank you for keeping it at the GTV. This is the Afya Leo program. My name is Caroline Bithe. And remember, you can be part of our programs, as I told you earlier, through supporting us via the till number that is 9686 9626 9626 and you can keep your suggestions and comments coming via the number 0711-352-883. And welcome back, Jen Dugire. And before we went for the break, I know people really want to know what is the importance of a couple going for the antenatal clinic rather than the pregnant woman going alone.
Thank you so much, Carol, for that question. And actually, I would like to help our viewers out there. It is very important for a woman to be accompanied by the husband or a partner, so to put it. Most of these women, when they are pregnant, they are so anxious. And actually, even especially the new couples, new parents, it is very important to give them the support of accompanying them. So mostly, actually, even them, as we advise them, we tell them to come with their partners. And mostly them who come with their partners, we give them the first priority. Because, you know, in our setup, in our African setup, men don't want to be kept for long, you know, in our facilities. Actually, in our facilities, mostly you will hardly see men. Wanakaa ngumu. Even when they are sick, they wanakaa ngumu out there. So when there are people who have been anxious, who have been waiting for their partners to be pregnant. So when they are pregnant, they want to come with them. But very few who want to join them. So we advise the mothers, come with your partner. The importance of them coming with their partners is that when they come and mostly when we come to some screening, like now when you're screening for TB or we are investigating for HIV, mostly would like them to be, the father of the baby to be part of this. And therefore, when we call them for the investigation or for PITC, we would like the partner to be involved. So, the importance, most importantly, when he comes, the investigation will be done parallel when they are both there. It is not a second-hand information whereby the mother will go and tell the partner, I was done this, or even will fear, I was done in the investigation and the results were positive. Or TB, like now when I come to screening of TB, and then I realize the mama could be having the TB. When the baba is there, it is very important he will hear by himself, and the investigations will also be done to him.
Okay, and you talked about first, second, and third trimester. So there's something about gender reveal. So when the gender, revealing the gender, screening for the gender.
Gender?
To know gender. Is it female or anabeba?
Okay, gender.
Gender? Chana, yes, okay. Gender. At what trimester or month gani yenye unaweza sasa jua, unaweza fanya the screening for the gender?
Thank you so much. Every time they come, we advise them to do in the first trimester, so that they can diagnose some problems. And also, whether, the scan will make us know whether not the gender this time, but the scan itself will lead us even to know some problems in the uterus during conception or during the attachment. Whether the baby is well attached, where it should be, whether there are problems or dysfunction in pregnancy. That is the first scan, the first trimester, the 3 months. Then at the end, during that trimester, that one now will tell us the gender. But the first one will make us know whether there are problems. Like now, poor implantation ama tuseme in a language that can be understood, whether there is the placenta is well attached, whether the fetus, the zygote is well attached or implanted.
Okay.
Yes.
Okay. And
so we recommend two. The first one to diagnose the attachment, the implantation, and the second one during the end to tell us whether the gender of the baby is female
or male.
or a male.
And there are women who, when they come to your facilities, you refer them for the
Cesarean.
Yes, for the cesarean. At what point do you decide that a woman should just pass through the cesarean rather than the normal delivery?
Carol, I'll surprise you. When a woman comes, from the look of it, as she comes, I'm already making some diagnosis. When she's coming, when she's entering. You know, in my setup, my position, I look right from the gate. And when I see a pregnant mother, I am so delighted. I'm so happy. Because I'll start making my diagnosis from very far. A very short woman who puts on a number 3, kiatu, shoes, number 3, already I've made my diagnosis. This mama, hata epuka kisu huyu. Because a short woman, the pelvis is not adequate to give way for the baby. So, when they come in, I'll start from the now physical examination, looking at her, making my diagnosis. And then when she sits, I greet her. Already I had greeted her. So I ask her questions, and I see the number 3 type of a shoe. I look at the pelvis, and I look at her height. Although I'll take the height, another whatever, I'll make diagnosis. I'll tell her, you, according to how you are, I'll refer you to the hospital, and then I'll explain to her the reason why. Also, there are others who will come with history, family history, also problems. I'll tell you who is supposed to go for CS. Yes.
Okay.
Also, towards the end, there are people who come with bleeding per vaginum. Yani, they bleed early. Also, those ones we refer because probably the placenta has detached from its site. Also, we make diagnosis quite early. Yes.
And the first day of the antenatal care, that is when you get to alert this woman of the day she's going for the delivery, right?
Pardon?
When she comes for the antenatal care, hapo ndo mnamwambia then hizi ndo siku zako, unaweza from this time to this time unaweza kuwa unafaa kuwa uko ready for the delivery.
Yes. When she come to our clinic the first time, as I said earlier, we start now making diagnosis. We start knowing whether she's pregnant or not. We start our clinics. She tells me that her periods were at this and this time. I'll do some calculations to know the EDD. There are formulas for that. So I'll do my calculations to know the gestation period. How for how long she has been pregnant. That is what we call the gestation period. I'll ask her last menstrual period. When she tells me her last menstrual period, I'll count. There is a formula for that. I'll count and to get the EDD, expected date of delivery. And then, up to now, the day she has come, I'll know the gestation period of the fetus in the utero. Yes.
And what happens, unapata watu wengine wana deliver mapema, wengine wanachelewa kidogo with around a week or
Yeah, there are discrepancies. It is okay. Once the baby is grown or is mature in the 9 months, to say from that is 6 weeks, that baby is mature enough. And surprisingly enough, when the baby is in utero, first trimester, the third month, the fourth month, this baby can hear you.
Ah.
Yes, this baby can hear you. This baby starts recognizing the voice of the mother. When the mother is annoyed, this baby will tell.
Ah.
When the mother is anxious, this baby will tell. This fetus, that is only a zygote that can never detect the mother. But hizi trimesters zingine, this baby can tell. So, when the baby is the second trimester, the third trimester, this is a grown baby who can detect all types of nuisance around her, around him. Hata wakati mama anateta, hata wakati anateteshwa, this baby anajua. Yes. So, umeuliza about the
delivery. Mtu anadeliver mapema ama anachelewa kidogo?
Anachelewa kidogo. Because kuna other things that can make a woman deliver mapema. Discomfort ama trauma ama the baby is grown and now the mama is not comfortable. The situation is not comfortable with her. Such things trigger the pregnancy. It triggers the pregnancy to quicken and the labor pain start. When the mama is not comfortable, the situation is not conducive. There are some things that trigger the pregnancy for delivery to come earlier.
Okay.
Yes.
Okay, thank you so much for the discussion. And now, because my director is telling me, Masa, now you can have a minute or 30 seconds to our viewers, someone out there who is pregnant and anaogopa labda kuenda, maybe you can have a minute or 30 seconds, umuongeleshe kidogo, umueleze what is the importance of this.
Thank you so much. Viewers who are watching GTV out there, it is very important to come for antenatal clinic early as the first trimester, as early as you realize that you are pregnant, as early as you'd like to be told by the doctor or a health worker that you are pregnant. It is very important to come early so that we can detect the pregnancy and also detect how the baby is, the well-being of the woman and the well-being of the baby. So when you come in the clinic early, we advise you accordingly, we treat you accordingly, we advise you accordingly, and also we refer you accordingly. We also assist you to make a birth plan. Birth plan is that preparedness, that plan that you prepare for well-being of the pregnancy and also well-being of the delivery. And also postnatally, we shall advise you about your family planning, the subsequent pregnancies. So when you come early to the clinic, we will have an ample time to discuss about your pregnancy, your well-being of the baby, and also your spouse. And it shall be very important. Once we know your blood group, and we realize that your blood group is not fitting for subsequent pregnancies, we also advise you what to do, what to take, the treatment to take. So I would advise mamas out there to come early for antenatal clinic so that we can screen, investigate, give promotion, and also advise them accordingly. That is, give the health education.
Okay, thank you so much for the discussion. Thank you even for that advice that you've given to the women out there. Thank you for keeping it at the GTV. That was the Afya Law program. My name is Caroline Bithe. See you next time.
Thank you. Bye-bye.